Good afternoon, everyone. My name is Jashandeep Singh, and I am from LV Prasad Eye Institute. The title of my study was Progression of Age-Related Macular Degeneration in Indian Cohort, a Big Data Analysis. As we all know, AMD is a chronic progressive disorder of retina and is a major cause of central visual loss worldwide. According to studies, the prevalence of AMD in India is ranging from 1.4 to 3.1%, and it is expected to increase with coming decades. AMD can present in early or intermediate forms with variable sizes of drusense. Also, it can present in advanced stages, that is, presentation as a geographical atrophy or a neovascular AMD. Chakravarti et al., they presented a literature on risk factors and progression of early or intermediate AMD to advanced AMD in a larger UK-based cohort. But there is lack of studies reporting longitudinal changes of early or intermediate AMD in Indian cohort at a bigger level. So the purpose of our study was to analyze the longitudinal follow-up and rates of progression of unilateral or bilateral early or intermediate AMD to geographical atrophy or neovascular AMD. It was a retrospective, multicentric, EMR-based analysis. Patients with unilateral or bilateral early or intermediate AMD with a minimum follow-up of 1 year were included. A total of nearly 19,000 folders were retrieved, and out of which more than 15,000 folders we have to exclude due to poor documentation. Baseline demographics, the fellow eye status, and a comprehensive examination was done for all the patients. Apart from it, longitudinal changes in fundus characteristics and OCT features were also noted. So we had 3,230 patients which were included in the final analysis. The mean age of the cohort was 59.83 plus minus 17.16 years. And the baseline best corrected visual acuity of the cohort at baseline was 0.26 logmar. And after a mean follow-up of 3.3 plus minus 1.9 years, the visual acuity decreased to 0.36 plus minus 0.49 logmar. And by the end of the follow-up, nearly 11.7% patients developed de novo CNVM, and almost 2% patients developed progressed to geographical atrophy in at least one eye. The final visual acuity was worse in the eyes that developed geographical atrophy than the eyes that developed de novo CNVM, although the difference was not statistically significant. On multivariate analysis, presence of advanced AMD in the fellow eye and higher age were the most significant risk factors for development of de novo CNVM and also progression to geographical atrophy. These are the representative images in which the patient presented with the early AMD in both the eyes with early foveal atrophy in the right eye, and after a follow-up of 4 years, the patient had geographical atrophy in both the eyes. Another 66-year-old patient who was treated with 2 intravitreal injections for CNVM in the left eye, but there was early or intermediate AMD in the right eye, was lost to follow-up, and after 3 years presented with the right eye CNVM as well. So we concluded from the study was the progression to advanced AMD was more commonly seen in older patients and eyes that have advanced AMD in the fellow eye. And also this study provides insights into the rates of disease progression in Indian cohort and aids clinicians in risk stratification, planning, and monitoring, also the follow-up of AMD patients. These are the references which I have used. Thank
you. I'm just curious, why did you say big data analysis in your title?
So we included more than 3,000. We analyzed 3,230 patients, but the data was retrieved for almost 20,000.
What is the existing largest study on AMD?
It is UK-based analysis of some 17,000 patients.
No, I meant the follow-up. You did a 1 year follow-up, right?
No. The mean follow-up was 3.3 plus minus 1.6 years.
So otherwise, just for your knowledge, the largest follow-up is the Blue Mountain Eye study, which looked for 15 years data. Yeah. I don't know, I was just curious, why did you use the word big data? Just because you screened a lot of files.
And we analyzed a lot of patients.
Fine.
Okay, so I had one question. It's nice data, but the point is that what new would you want to come up with this, and what is your message from? Why did you do this study, and what is your message out? Where do we take this from?
Yeah, so just in a clinical scenario, if a patient comes to us with the early intermediate AMD in both the eyes, our follow-ups will decrease for a patient who has advanced AMD in other eye. So it is better for counseling the patient as well as for our risk stratification also.
But I think that data is already there. I think what new is coming out of this?
So it is not for Indian-based cohort, a larger Indian-based cohort. That's why we're doing it. Thank you.